Hello and welcome to Everyday Oral Surgery. This is your host, Dr. Grant Stucki. I'm an oral and maxillofacial surgeon practicing in Denver, Colorado, and I really appreciate you tuning in today. The goal of this podcast is to connect, learn, and inspire. In this podcast, you will hear from OMFS surgeons, other dental specialists, generalists, and medical providers discussing ways to improve the practice of what we do in surgery. Most of the information shared in this podcast will be based on personal experience and opinions, so please supplement what you learn here with evidence-based research study. Without further ado, please enjoy today's episode. Welcome back, everyone, to another episode. Today I'm with Doctors Benjamin Palla, Jake Stucki, Dr. Michael Miloro. Appreciate all you guys joining us on the podcast. We're going to be talking a little bit about some board prep and kind of a board prep course to go along with that. Ben, where would you start us off on this discussion?
Yeah, thank you, Grant. So I'm Benjamin Palla. I'm a private practice oral surgeon. I'm practicing in Santa Monica, California. I graduated from UIC in 2024. I'm from Chicago. I went to dental school in Boston and then came back to Chicago for residency. And then I worked my way out here afterwards. One of my best friends and co-residents bought a practice here. So bought a practice from a retiring oral surgeon, Stephen Needle. It kind of had the bones of the practice. And then we've been spending the past 2 to 3 years slowly growing that. So a lot of it is, when I graduated, getting into the course, it was looking for myself. Okay, well, take the board's exam. How can I prepare? And it kind of got me looking for what options are out there for preparing for the oral comprehensive exam, and just overall, how can I structure the next essentially 6 to 8 months after I graduate in order to be successful about that. So I know there's previous podcasts. I mean, you've had a bunch on recently with even Dr. Genser's doing a great job kind of focusing on the ABOMS exam, going through mock cases. So, I mean, really, this is kind of a chance for me, I appreciate, to plug the review course that we started, the Los Angeles review course. If anyone has any questions, information, anything about this, we'll go over a bunch of it today, but they could also just go to losangelesboardreviewcourse.com, and it's going to have a bunch of stuff on there. So yeah, as far as motivation to start the course, the first thing, I came out to California and I was kind of surprised. A lot of us know, there's a great course in Denver, a great course in St. Louis, one in Nashville that I always heard about people attending. But, out in California, despite LA metro area has a greater population, I think, than 40 out of the 50 states, compared to the country of Hungary, I think we may dwarf them in many ways. But, we didn't have a course out here on the West Coast. So for Oregon, Washington, all the way down towards, Nevada, Texas, even, there's nothing on the West Coast. So there's 8 programs in California alone. I just wanted to set up something out here where it was geographically accessible for us. So that was the first thing. The second thing was then graduating, and, you remember you're a resident who's getting done with their program. They're looking to move around the country, start a job. And, a lot of these other courses are 3 days long, 4 days long, 5 days long. And to be honest, for me, I just didn't want, it's a whole week off of work, off seeing patients, kind of meeting dentists, being able to accept that emergency, especially if you're running your own practice. So I structured this course. It's just one day, and we'll get into it. It's one day. It's on a Saturday. It's not just really a review course, but afterward there's a study club that's attached with it. But that one day you can be in clinic all week long. It's on a Saturday this year. It's on September 5th, Saturday, September 5th. You can register, online for that date if you want, but it's one day. You get to keep everything with your clinic or schedule, traveling, family, all the holidays you get to keep for yourself for later on. So that kind of brings me then into the third and final thing along with that, which was just the money. So the other courses, you're graduating, and I think most of them are like $2,500 for St. Louis or Nashville. Then you have a hotel cost, the flights on top of that, and you're taking a week off of work. So it's just, you've made like $5 an hour in residency, working kind of like a dog. And then you have to move across the country, start this job. And unless you have, if you work for a larger corporate office, a lot of times you're kind of lucky they pay for some of this stuff. But for me, I wanted something that was also financially acceptable. So we'll talk more about the course structure, but our course in Los Angeles is $1,500 if you're by yourself. But if you register with somebody, which Jake can kind of tell you about the benefits of getting that partner early on. If you register with somebody, then our course only costs $1,000. And that's for the course. We do weekly mock cases. We have a study group, kind of a mentorship through there. And we have a study guide with 20 cases. So, I mean, all those things together is kind of what I would consider the highlights of the Los Angeles Review course.
Yeah, that's awesome. Great to offer a course. It's on the West Coast at a little bit of a discounted price. What's the structure of the course?
Yeah. So the course, like I said, it's going to take place on one Saturday. That's the in-person portion. And then there's another portion afterwards where we're going to talk about kind of these weekly mock cases. I don't want to divulge too many secrets about the course itself. The whole point of this course or any other one, it's really to prepare you to be successful when sitting for the oral comprehensive exam. And there's like two components that I always would say people need to focus on: the knowledge, which most of us, you finish a 4 to 6 year residency program, you have a significant amount of knowledge. The other part is preparing and almost developing a new skill, being able to articulate something orally. That's, without getting into too many details, really what we try to focus our course on. So the first part is the in-person portion, Saturday, September 5th. It's from 7 a.m. to 5 p.m. Every hour we're going through a different topic. So, for instance, in the morning, 8 a.m. to 11, after we give a little intro, we cover infection, pathology, orthognathic surgery, trauma. We're very lucky to have Dr. Michael Miloro giving 2 different lectures, orthognathic surgery and TMJ. We have Dr. Thomas Schleve from Parkland, Dallas, coming this year to also talk about pathology and reconstruction. And then some returning lectures from last year. Stephen Lick's talking about infection. Sam Caruso is talking about trauma. And Sebastian Graca is covering dentalvelar surgery. So we have great lectures. Each hour they're giving a lecture. And the way it's broken down is that they'll start off each hour inside of that topic. They'll do essentially a 15-minute mock case with a review. And then they're going to go over some important information afterwards about, what is the necessary information that they feel is relative to this topic. They'll go over kind of the right and the wrong answers. They'll give some suggestions, and then they'll do another mock case for the next 15 minutes, and then a 15-minute review, basically. Just to introduce these, there's no way that any of these courses, even if it's 5 days long, it could be 2 weeks long. There's just way too much knowledge to have in these courses for the exam to really be able to cover it all at one time. So what we're trying to do is give you a little bit of, spray you with, turn on the hose, a fire hose, and just kind of spray you down at the beginning, let you soak things in. And then we'll get into, each week meeting and like slowly refining and developing that skill. It's like running a marathon. So you can't prepare for a marathon in a 2-week period, or you can't take a 5-day crash course. Okay, you can now run 26 miles. People who run marathons, I think the average distance they run in that year before, if they're trying to be competitive, is like 1,500 miles. So there's a ton of work to go into those 6 months beforehand. That's another reason why we chose the course to start so early. You start early in September, it gives you, I forget, I had the exact maybe 144 days last year, gives you the time in order to prepare weekly to slowly develop those skills and increase that knowledge over those 6 months and prepare for the exam in February.
Yeah, I love that structure of kind of one day in person and then multiple sessions where you're preparing each week, doing a mock case, reviewing it over, a long period of time. I think that's super helpful. All right, Ben, any comments about the study guide for the weekly mocks?
Yeah, so the study guide, we, kind of registering and enrolling in the Los Angeles Review course, one of the things that we provide you, besides these weekly mock cases, and all of those mock cases are recorded. They're put in a Google folder. You can watch them by yourself. You can watch them at double speed. Jake can maybe tell you how he utilized those. But what I feel is kind of a critical, crucial, very useful tool is a study guide that I created. So it's a study guide. It's about 150 pages. It has 20 chapters, and each chapter is basically a case. One of them's on infection, one of them's on orthognathic surgery, TMJ, and it'll walk you through that case where it asks you a question. You can even cover up that question with a note card, ask it to yourself when you're reviewing on your own. And then the answer that I've provided would be underneath, or at least a suggestion. And besides having a tool where you can practice those cases by yourself, practice, those verbal responses in your head or out loud, I also think people preparing for an exam with this broad of a scope, you have so many resources. And one of the things people typically get in trouble with is where those resources start to either contradict each other or conflict with each other, or just list such a broad range of information, whether it's what percentage of patients develop dry socket after third molar surgery. Or the study guide is also something that, as we have this study group and we're progressing through these sessions together, everyone has the same study guide, everyone has the same reference, so that you can continually go back to the same number, information, the same list. Oh, if you displace a third molar, tooth number 1 during a procedure, what are the places it could go? Like boom, 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 boom. Be able to list them out and organize them in a way so that you always go back to the same information. You start blazing that in the back of your skull, and when it comes up, you're able to regurgitate that information in a articulate manner, and then also in a time efficient manner.
Dr. Miloro, what are some study tips that you would give to a resident preparing for the oral exam?
You have to attend the LA review course to get that answer.
Okay.
This is a really unique course. Ben's been talking about some of the unique characteristics of this course. I think that study guide is really comprehensive and extremely valuable. The setting of the course is incredible, like right on the beach in Santa Monica. You can't ask for better than that. I don't think any of the review courses is in a venue that's like that. A one-day course, nobody else does it in one day. The cost of it, all of it makes it really unique. And the other thing is that it's run by former trainees of mine, and I'm really proud that they put this together and want to continue to advance education in our specialty. So I think my role has been, acting as one of the examiners. It's small group sessions. It's really like you feel like you've got a one-on-one experience, which is, again, not true of other review courses. So tips for the boards. Well, it's a high stakes exam for everyone. Everyone's nervous about it. And I think, everyone's got a paranoia, but it's got to be a healthy paranoia. If you can understand what that means, I think everyone is extremely nervous. And if you can put that aside and understand that the examiners know you're nervous and they expect you to be extremely well prepared for that day, it's the day to shine. So preparation is key to anything. Preparation is key to surgery. Preparation is key to examinations. As you all know, I don't think I ever went into an examination thinking I would get less than 100%. And then if I got 98%, I was disappointed. You don't shoot for 80. You shoot for 100. So this course helps with the preparation. It stresses the fact that you should be doing this in a group format. I'm always surprised still to hear that surgeons preparing for the boards are just reading Peterson's or, reading textbooks, reading articles. That's not the way it is. And I think this course stresses the fact that, I don't know if Ben talked about it too much, but it's developing a new skill, a skill of being asked a question and answering it and playing the game. So it is a game. The examiner is asking a question. They expect an answer, without much delay. You've got some delay to think about your answer, but if you delay it too long, it's awkward. And you want to avoid silence, because silence doesn't get you points. And the examiners are looking to help you. They want you to pass. All they're really interested in is knowing that you practice safe, competent oral and maxillofacial surgery. And that's really the goal of the examination, by presenting you different case scenarios, which you may or may not have ever seen or may not ever see, but just working through them and practicing safe oral surgery.
I love that. I mean, I'm sure we've all had the experience, those who've taken it, of binging, tons of information as fast as you can for a month beforehand, and you just try to dump it all out. But like you're saying, there's a method that you have to present it in, and it's critical to do that. Any other comments on that? Those studying habits?
Yeah, definitely no binge studying. I think one of the things that examinees might not think about that I like to stress is the examinee should consider recording themselves, either video or audio at least, and listen to their answers. And if you listen to yourself, you'd be really surprised that I can't believe I said that. That's not how I thought I was portraying my answer. So I think you should listen to yourself. Definitely study with somebody else, get feedback from them. One of my famous quotes about taking the examination during the examination is having diarrhea of thought and constipation of speech. So your mind is going a million miles an hour. They're asking the question, you have the slide and you're thinking, and you can't just start talking randomly. You have to consolidate all of that information that's going on in your head and have constipation of speech. Just try as succinctly as possible to get out your answer.
That's fantastic. Jake, we were going to ask you a little bit about your experience. You've attended the course. Can you tell us a little bit about your experience there?
Oh yeah, it was awesome. So first of all, I just want to say I'm extremely grateful for Ben and for Dr. Miloro and all the different people who were involved in that course, because it was a total game changer for me. As a quick review, so like all the residents now, if you're as a chief, you'll be taking they probably already took it, the written portion of the exam, and you get your results a couple months later, which allows you to register for that oral certifying exam. So I was essentially sitting at that point, ready to graduate, just kind of like pondering upon what was I going to do to tackle this next challenge, right? Because everyone sees the oral certifying exam as like the end all be all. Like you've been preparing, you've had this in the back of your mind for years and years. You heard everyone else who took it, how hard it was, what it was like, how stressful, and you just are wondering like, what do I do to go about doing this? Ben mentioned you've already learned so much in residency. You've been studying like crazy. Hopefully at your program, you've had program directors and other faculty just constantly asking you questions all throughout and just really putting you on the spot to make you more comfortable in those scenarios. But the truth is you're still, I was pretty unsure about what's this going to look like. So, my experience, I was so glad that this course started early, because that was one of my concerns, is just as time was, after I graduated, start working, time was just getting closer and closer. Those days were ticking down to the exam, and I felt like I didn't feel like I was making steps to prepare quite yet. And I was like, man, there's so many courses that are just months away. Like, what can I do now? And so I registered with a buddy, myself and Braden Oakes, who was my co-resident. We went out to California, which it was very convenient. The fact that it was one day, didn't have to call off of work, was awesome. I really appreciated that. I would have flown across the country, honestly, to go to this. The fact that it was in California is nice. I went to UCLA. It was nice being back home, but still, it was so worth it. At the program, at the actual session, it really just felt like, okay, I'm officially starting. Even though I've started, even though I've learned so many other things, like, you really feeling that fire getting you going. And what is it you need to do? Like you guys were just mentioning, it's much more than just sitting down and studying like you've been used to doing. It's changing the way you think about things and really preparing to explain and say the things you know. So I thought the in-person session was incredible for really impressing the seriousness upon me, and also just what the format's like, what to expect, envisioning the day of, all that kind of stuff. And one of the biggest benefits I also had at the course was meeting the other people, recently graduated residents and surgeons who were ready to take this course. So I met from UIC, Kai Kodner and Mike Schiappa, who ended up, we kind of hit it off and ended up deciding to do our weekly group meeting. We actually did 2 or 3 times a week from August until the actual week of the exam. And studying with those two and with Braden, my co-resident, I got to give a huge shout out to them, because the course really got that going with so many different groups. And that was, monumental for us. We not only did we prepare cases, we went over cases, we were taught in the course, like what kind of things, should you be looking for? How should you critique each other? How should you explain these things? And my group was just incredible. We didn't go easy on each other. We spent just so many hours together. By the time we took the exam, it was kind of sad. We were like, I guess we're not meeting next week. Send a message and check in. Hopefully you guys are doing well. And then on top of that, in addition to the group that, Ben kind of helped us set up, there was a weekly session that we would meet with everybody, and all the different groups would come together. In addition to I liked a lot to see the cases, to get the opportunity to practice with a little more stress in front of everybody. But it was good to see how Ben kind of proctored those cases so that we could then imitate those during our sessions. We weren't goofing around. We weren't wasting time. We really learned from his techniques and just the way that the board exam is, known for being. So that was my experience. And it, honestly, I have to say, and speaking with my group after we took it, the real exam was it was like we were already locked in. Obviously, the stress was much, much higher. We were so well prepared that everyone in my group, at least, we all passed with flying colors. We all felt like it was just another practice session that we were doing in terms of answering questions and just sticking to the main points.
Yeah, I think two things, if I could jump in and interject for Jake, who only would have passed his exam with the guiding hand of Dr. Miloro and myself. It is exactly what he said. Studying in a group where you are verbalizing things to each other and you're kind of pushing each other, and you don't know what scenario is going to be like until you're put on the spot, until somebody asks you, what is diabetes? And you have to describe it to them. The first time, I'm sure anyone who's sat for the boards or practice for this, you probably remember that first time you actually got the question in real time, whether it was in front of your co-residents, in front of a group like this, but it's practicing with each other. And that's another reason why we try to incentivize so much, joining this Los Angeles review course with a partner. I mean, it's a $500 discount if you, kind of come with somebody else, because that's really what's going to make the difference. If you hear, Jake studying multiple times a week with these other groups, and really what our session is this year was Monday, basically 5 p.m. Pacific Standard Time. We had it at the same time every single week. If you could join, great. If not, it was recorded on Google and I uploaded it for everybody. But it was the same structure as the course. I would log in at 5. I'd have 2 cases. So I had a list of who had done a case most recently. I'd ask somebody to do a case. It'd be 12 minutes. Then I'd review that case, go through the PowerPoint slide, critique maybe how they answered some of the questions, and then specifically also got into some of the information that I was trying to elicit from them, some basic principles about, if one week we would do TMJ, the next week we would do trauma. Some of the other lecturers also help out. Sam Caruso did a trauma lecture. I have a fellowship trained plastic surgery friend who did one. And we go through those topics. We highlight the important information. It's a great time to ask, if there's some principle that's really kind of tripping everybody up, especially with some of those the topics that are found in section 3, the focus topics that can cover like anything from MRONJ to soft tissue, pre-prosthetic surgery. It was a good time to try and delve into some of those concepts and review them together. And that's what, doing it slowly each week, 22 by the time we finish, 22 videos that you have to review, 22 times you've answered that question. Almost the goal is that when you go on the exam, it's like, hey, I've answered this 3 or 4 times before. Your answer, you've practiced it, and it's like a basketball game. You've shot the free throw the whole season leading up to the playoffs. You just have to repeat it when you're kind of under pressure and everyone's watching.
Any other comments you had about it, Dr. Miloro?
Yeah, as we're talking about sports, during the exam, we like to use a golf game as a guide. So maybe you have a case and you shanked it into the woods, and really it didn't go very well. I think you have to forget about that hole and go on to the next hole like it's a new hole. I was an examiner for 6 years, and I constantly see or listen to the examinee say, we're on the next case, and they want to talk about the case we finished. Don't do that. It's already closed. That hole is over. You can't go back. So just move on. The other advice I'd give is, I don't know is a reasonable answer. Nobody knows everything, and the examiners don't expect that you know everything. So rather than waste time, again, with silence and not building those points, saying I don't know is a reasonable response, and they might help you. They might use the Socratic method to elicit what you do know and try to get you to the answer. And ultimately, what it comes down to, my best advice is really treat the patient as you would in your office. That's really what the exam is about, is presenting you cases that, again, you may or may not see in your practice, but if you did, this is how you would manage that patient.
The other quote that I certainly didn't make up myself, and I can't remember where I heard it, unfortunately, but there's things that you need to know, there's things that are nice to know, and then there's just things that are nuts to know. So once again, the scope of this exam covers such a broad range of topics. The field of oral surgery has such a broad scope. Practice, you could go through Peterson's, but it's not necessarily going to elicit the information that would be useful to sitting for this exam in a successful manner. The exam is almost testing a new skill, how well you can articulate a concept that you do know. And sometimes it could be something basic. What is high blood pressure? You'd be surprised maybe on how difficult it could be to describe something that you encounter every day that you feel you're an expert on. Sometimes it's those topics you really know a ton about. MBRONJ or trauma, and you all of a sudden you start getting into the weeds about some new article. That's not necessarily, I feel like taking the exam, you redefine these concepts in your head and you can describe them in such a way that actually what I enjoyed is now talking with patients. I notice a significant change in how I talk with patients. If you really understand a subject, truly, you can describe it at kind of a greater reading level. You can have a third grader understand, the importance behind it. And I almost think that's where you're functioning throughout this exam is you're getting questions about different topics and what you would do, how you would treat the patient. It's not that you're not describing some article you read in JOMS from the month before and the statistical analysis. It's, this is what I perform in my office and my hands, what works best. And, this is how I would stage it and go from there.
That was my quote, Ben. I know we spent 6 years together, but I don't expect you to remember everything, all the words of wisdom I gave you. But nice to know and need to know is certainly one of my quotes.
I'll update the study guide. I could tell really that, the moment that Jake hopped on and he referred to me as Ben and Mike as Dr. Miloro, there's a level of respect.
No, you're definitely getting there. I will say, though, that quote stuck in the back of my head the whole time I was preparing. Because when you're preparing, it feels like everything you need to know everything, right? And when you're working with other people and really studying outside your bubble is when you realize, okay, this is too much. This is what I need to focus on, these concepts that I don't get. And then the other thing that I found so helpful was just nobody wants to be put on the spot. Nobody wants to go up in front of anybody else and be uncomfortable and try to explain something that they're not used to doing. I mean, it's just so valuable to experience that and try to get used to it, trying your best to get comfortable being uncomfortable. And then what I found was some recommendation for anybody out there is bring a buddy and then go find some other people from somewhere else, someone who trained at a different school, someone who's learned different things. When myself and Braden were talking with Kai and Mike, there were so many concepts that they taught us from their background and their training that were just invaluable for us, and then vice versa. So getting outside your bubble, not just re-studying the things you already know the way you already learned them, I felt it was a huge help for me.
Yeah, you got some of that UIC knowledge there, Jake. There's no course you can sign up for in order to do that. You have to apply straight out of dental school. When you thought about that, need to know, nice to know, nuts to know, I just want to know, did you attribute that quote to Dr. Palla or Dr. Miloro?
I think it was a Dr. Palla quote at the time.
That could be my quote now. I did my time.
Jake, I'm surprised that some of the UIC philosophies haven't rubbed off from your brother.
There have been many.
For sure.
Yes.
Lots of UIC mentoring over the years, for sure. Well, I really appreciate you guys doing this. This course is a tremendous asset. I love how it's one day. I love the location, that it's at a discounted price. And I love that it's early and it kickstarts you off. And then you have these weekly cases that you're doing. And it's more of a long-term thing. So what a great resource that you guys are doing. And I know it's a lot of effort. So thank you for putting this together.
Thanks for having us, Grant. I appreciate it.
Yeah, thanks, Grant. Thanks, Jake, Ben. Always good to see you guys.
Yeah, likewise.
Thank you so much. I'll put your contact in the show notes. And this should go up online in the next week or two. So thank you so much. Have a good rest of your day.
Thanks, Grant.
Sounds great. Okay,
Yeah.
thanks.
Nice to meet you.
Yep, good to see you.
Thank you so much for listening to this episode of Everyday Oral Surgery. For more information on these podcasts, please visit everydayoralsurgery.com. I love feedback and would be very grateful if you would reach out to me via my email, grantstucki@gmail.com, and let me know what you thought of this episode. Or you can text me at 720-441-6059. Additionally, if you have any topics you'd like to hear about, or if you would like to be a guest on the podcast, please email or text me. I found many of my interviewees through people who have been contacting me and have been listening, and I've gotten so many great ideas for more podcasts, and that's what helps keep the podcast rolling. So I really appreciate you making that extra effort and helping me out with feedback and knowing what to do next on the podcast. Thank you so much.